teams, Lauren and Rebecca here with Bizrok. In this week's video, we're going to talk to you about emergency protocols and emergency operations. You know, sometimes we like to avoid these things, but sometimes it happens. It could be patients, it could be team, it could be a guest visiting our office. And so you've got to have proper protocols in place to best serve that person who has the need, right?
Yes, absolutely. The first thing that you're going to start with is making sure that the entire team knows the OSHA officer, who is in charge of the office and the situation during an emergency. You have your officer, and then you have the next in command that will be backup if for some reason the officer is out that day when there is an emergency. So that's where we'll start. After the officer is notified of an emergency, we do need a few things. We need to make sure all team members know where the AED machine is located in the office and how to utilize it. So this should be trained upon once a year during CPR training. So if your office offers CPR training, make sure during that training we're also training all new team members and checking the batteries and checking the status to make sure your AED is working properly. And there is normally a sheet on the machine that you fill out to date that it has been checked. So we should check the batteries once a month and check the machine for working properly every year during your CPR.
Do you like to have some sort of sign-off sheet that's on a monthly basis, or is it just like, hey, let's establish the same date every single month that we check it?
So there's a couple ways to do it. A lot of offices put it on the schedule, so that way a team member is notified, especially the OSHA officer is notified, I need to go check the batteries. It has a button, you press it, it's going to sound off, let you know that the batteries are working. And then on the machine, there should be a chart in there that you fill out that's going to be in the actual container that the AED is located.
Okay.
But I would just put it on the schedule. That way we can all remember it, because in case I am the officer and I'm off that day, then they can move that block to the next following day that I'm working, so I can make sure that I'm able to get it figured out.
I love that process too, of just moving it on the schedule as it's complete, right?
Yes.
Good.
That way we know that it's actually been completed. After the AED, what I always suggest is your ammonia tablets. A lot of offices are able to take the ammonia packet and actually tape it to the top of the light, because there is a light in every operatory. And normally if a patient passes out, they are in the chair. So we can easily grab that, pop it open, and put it right there in the patient's area where they can breathe it in, quick and easy, and get them back to. Most patients, if they pass out, it's because they're super anxious.
Yes.
And that's just, it's what happens. It's our body, and it's the sign that it gives us. So as soon as you pop it open and they breathe it in, they normally will wake up. The next thing for an emergency that I would like for everybody to make sure we're doing is, if we are using either the AED or the ammonia tablets, that we are notating that something was used. And if the AED is actually having to be used, of course, we're going to call 911. So your protocol within your office for your OSHA officers will go into effect, and the officers will do what is told to them during the trainings, being one person will call 911, one person will print out medical history, and then the doctor and the other officer will stay with the patient.
Yeah. I know that sometimes these things are like just check boxes that we check off every single year, right? And guys, you know that we like role play when it comes to communication and experience and case acceptance, but guys, this is so important to practice this thing. Yeah. And every single year, whenever you're reviewing it and you're going through that list that Rebecca said of making sure things are updated, but you're also actually walking through a scenario as a team, as silly as that sounds. And I know sometimes it's like, do we really have to do this? Here's the thing. It's not important until it is. Whenever it actually happens in your practice and you're like, what do I do? That's not where you want to be. You want to feel comfortable and confident and, hey, we're serving this patient, we're going above and beyond. Or this team member. We've been in offices where team members have passed out on the spot unexpectedly, and you know, the team rallied around, or the team was like, what do we do? And then we had to kind of jump in and help with them. So make sure that you have this as a best practice annually for walking through the scenario.
Yes, right? Absolutely. The last thing they need to make sure they have within the office and easy to get to is going to be an oxygen tank. So a freestanding oxygen tank, not one that is connected to nitrous. So not your nitrous oxide tanks that has an oxygen and nitrous. It should be freestanding with a free mask. And that is actually protocol. You can call OSHA and or any of the insurance companies if you are signed with insurance, and they will come and actually do a walkthrough of your office at no charge, and they will go through everything to make sure you have what you need for emergencies in your office. That way you know you do have what you are needing to have, but also if you're missing something, they will give you a notice and let you know what you need to get and where you can get it from, which is really nice.
Well, it's a nice reference. It's a nice opportunity somebody to just make sure that you're up to standards in case you have to go through this process, right?
Absolutely. You have your ER box too.
Yes.
That can't be forgotten. There is a great company you can go through that will automatically send you all your supplies every year, which is wonderful because then you don't have to actually visually see all your products in your ER kit and see when things expire. They keep up with everything for you. They send you a bag to place your other older products in. You send it right back to them and they dispose of them for you.
That's wonderful.
It is wonderful.
It's ease of business, right? So awesome. Well, guys, hopefully this was super helpful for you. If you need help or if you're like, gosh, how do I actually role play a scenario like this? Reach out to us. We'd be happy to help support you. But as always, we can't wait to see you and serve you soon.